Hello, I am recording about my experience with port-a-caths. And I had two different ports placed. And so I suppose if this were a literary novel, this would be called A Tale of Two Ports. So a port-a-cath is a small medical device that's about so big, and it doesn't have any metal on it. It's made of plastic, and it's put on your chest. There's tubes that connect to large veins and come down into your heart, so that when something like chemotherapy is put in through the port, it is quickly filled with like blood volume and flushed through really quickly, so that the toxicity of chemo is less intense, because there's all that blood volume flushing things around really quickly. So there are other benefits to having a port-a-cath. You can get blood work done through the port. You can also receive other infusions. I received iron infusions through my port. You can be accessed for things like other medical procedures, like maybe surgery. It depends on your center, but you can sometimes have surgery, or, other fluids, like if you're getting a CT and you need contrast or things like that. So it kind of depends on your center, but there are other uses for having a port than just chemo. But that was the main reason why I got both of my ports placed. And I had mine, I live in Appalachia in southwestern Virginia, so I had mine placed at a very rural hospital. So I have a little checklist of things I want to tell you about. So okay, my first port was placed in 2019 on the right side of my body. This is the scar. I don't currently have any ports in my body, but they've been removed. But anyway, you can see this one is about 6 years old, the scar. And then this one did not work, and I'll tell you a little bit about that in a minute. But then they removed this one and they placed a second port on the other side. If you have to have another port placed, they'll usually try to alternate sides. So they go to the other side and they place this port. And this port was, sorry, move my hair here. This port was placed in 2021, actually end of 2019, and then it was removed in 2021. So this one's about 5 years old, so you can see kind of what the scars look like after time. So I'm just looking down my list, see what other things I wanted to point out. Okay, so this one was placed in a general outpatient procedure by a general surgeon. So I had anesthesia, and it was just the normal process that you go through for surgery, for outpatient surgery, arrival, IV, change your clothes, all of that. And then recover in a small room and then go home the same day. So the whole thing took several hours at most. And then I was home recovering. The recovery was really easy. I get kind of emotional about like blood and guts and things being cut open. This one was really small. I was nervous to see what it would look like, because the bandage they had put on was really, really big. But it was just poofy, the bandaging. But once it came off, it was really nothing other than a couple of stitches, and did not look that impressive or bother me very much. So that one was done through general outpatient surgery, but there are more than one ways to get a port placed. And when this one failed to work, we needed to place the other one pretty quickly in order to get it done before my next chemotherapy. And so the only thing that was available where I live was a procedure that's done in the radiology wing of the hospital rather than in the surgical wing. And it's also outpatient, so same day. But I was not anesthetized for it. I was just given some things to relax me and some local anesthetic. So I was fully conscious for having this one removed and this one placed. I talked to the surgeon the whole time. We had both been to the same place. We had both traveled to the same place in Africa, and we were talking about our experiences hiking. And I guess at some point I must have fallen asleep during the procedure, because when I woke up, they all wanted me to finish the story that I was telling them, because I must have fallen asleep and I didn't even realize it. So anyway, both were very positive experiences. I think my preference, I respond pretty strongly to anesthetics, so I don't like feeling that way afterwards. So my preference was for the radiology experience, which was faster, and just less that I had to navigate. So I didn't mind that, but obviously some people might feel more uncomfortable with being awake during a procedure like that. They do, so they cut here, and then they also do a small incision, depending on what vein they use. They put my port through my jugular vein, down into my superior vena cava. And so there's a little incision with like one stitch. I don't even actually know if they used a stitch. They might have just used glue. It's been a while. Anyway, tiny. And like the healing of that, it just came off like a scab that I would have for a scratch. But I do remember when they were doing this one, the surgeon who did the operation in the radiology wing was a vascular surgeon instead of a general surgeon. So he deals with veins. Anyway, while he was cutting, he said, "Could you stop talking for just a minute while I make this one small incision on your neck?" So I guess I was moving around a lot while I talked. So he just wanted me to hold still, which makes sense. So they were all very nice, and I felt like it was a good experience. And then when I had this one removed, about a year and a half later, I was getting some shoulder pain that was preventing me from sleeping well. We tried physical therapy and some other things didn't seem to work. And so we thought, well, it might be the port. And so let's get it removed and see if that makes the difference. And it did. So we took the port out. I was NED at that point. And that was removed by the first surgeon, who preferred to use general anesthesia for the removal. So it was in and out and in and out. But let's see, what else did I want to tell you about this? Okay, so the problem that I had with my procedure, or with my first port, was they called it a kink in the hose. So they had put the port in, and everything, after they do the procedure, they flush it in the operating room or in the radiology wing to make sure that everything is working okay. So at the time that it was placed, everything was working fine. For whatever reason, something went wrong later, somewhere between the point of me getting it placed and when I went in to get chemo about maybe 5 days later. I think it was less than 2 weeks, but I think it was more like 5 days. And I went in to get chemo, and they couldn't flush fluids through the port. So they tried different things in the chemo room, in the infusion center, to see if they could get the kink out of the hose. Like they had me almost kind of stand on my head. Like they had me flip my head over and put my head kind of down on the ground and like raise my arms and kind of do a little bit of some gymnastics, as much as my body was comfortable, to try and like move things around to see if they could get the port tubing to open up, but it did not work. So that day I got chemo through an IV in my arm. And I know some people only get IV through their arm, and so that is an option. I did not prefer it, and it burned a lot. Like my most uncomfortable chemo was that chemo, and I felt like my arm burned for many days after receiving that. And to this day, I don't know. I can't prove that this is related, but I often wonder if it is. But to this day, I can't really get blood out of that arm. Like it seems like there's a lot of scarring, or something possibly to do with having chemo there. So anyway, I did not love getting chemo in my arm. So I was anxious to get another port placed. And so I ended up getting the other port placed just maybe a day or two before my second chemo. It wasn't a lot of time. And that one worked fine. I will say that before they placed the second one, they wanted to make sure that there really was a kink and that it wasn't another problem. So I went to the radiology wing, and they did a dye study. So I was under an x-ray machine with a radiologist in the room, and they injected some dye, or they tried to inject some dye into my port to see where it would go, but it didn't go anywhere. They couldn't get it to go through. So it was truly clogged. And that's when they decided to take it out and replace it. Okay, so that's what happened. And then I got the other port, and it worked like a dream. I never had any problems with it. I had it for over a year. It worked great for all my chemos. Like I said, I used it for iron infusions and other things over the course of that year. And then I had it removed, and I didn't have any problems when I had it removed. Again, very quick recovery. It doesn't really impede your ability to do very much for very long. So that was that. Okay, I feel like I've covered most everything. Okay, there's one more thing I wanted to mention, which is that I was super nervous about... So like I said before, I get kind of nervous about having like, I'm one of those people that probably would not have made a very good nurse or doctor. I don't like blood. I don't like to see my blood. I don't like to see other people's blood. I don't like to see the inside parts on the outside. So even a small procedure like this was something I wasn't super excited about. But the thing that made me most nervous was that I know how long it takes for the skin to heal. And I was worried about having an open incision, an incision that is still healing, with the port needing to have a needle be put in and out of. I was really nervous about that because I was like, oh my gosh, are they going to like stick a needle through my like still cut open and healing skin? And that sounded awful to me. So a couple things I want to share that made that less, that I've learned that I wish I had known. I didn't know it before, but I know it now. So where they put the port in, or this one's a little bit easier to see, this is the incision that they use to put the port, but the port doesn't usually sit right underneath the incision site. It usually sits a little bit lower. So the place where you're getting the port, the incision, is not where like the needle for your chemotherapy is not really going to go through there. Probably it's going to be like lower down. I don't know if it sometimes is above. I don't know. But this was where the incision was, but my port was down here. And same for this. This is where my incision was, but my port was down here. And then the tube goes up. You can sometimes feel the tube through your skin, depending how lean you are. I could always kind of feel like a little rubber tubing right there if I rubbed on it. But anyway, so underneath the port, the nurse will use like her fingers to feel. There's these 3 little, nibs on the port, and that helps them know where the entry point is. So you can feel those. My son was 6 at the time, and he liked to rub my chest and feel those little spots. He called it my tombstone. I don't know why 6-year-olds are weird, but anyway, so the needle is not going through like the newly healed skin, if that's something that worries you. And another thing that I didn't know about, but they told me at my infusion center, was that I could get my doctor to prescribe EMLA cream or pick up like lidocaine cream, Prilocaine. I'm not sure if that's the word for it, but anyway, there are creams that will numb the skin, and what you do is you just put a big glob of it on, almost like you've just like made a mess of toothpaste. You don't rub it in, you just glob it on really thickly, and then I would cover it up with like plastic wrap, and then you don't rub it in. You're just trying to keep it so it's wet on top of the area. And then you go in and you don't really feel anything when they access your port. So I did that as well because I was nervous that they would be moving the skin around and it would be tender because it was still healing. But also at my infusion center, they have something that they'll spray on your chest to help numb the area too. So that's maybe something you can ask for. But it wasn't really a big deal. And the thing that I was afraid of the most, that it would really hurt because the skin was still healing, wasn't a big deal. Especially this one was just a couple of days before I had my next infusion, and it didn't bother me at all. So so that's my tale of 2 ports, and I'm happy to answer any questions if anyone has any, but I hope that makes it easier if you're nervous about getting a port. I definitely was, and I know it seems like a small thing, but when you're dealing with like so many big things associated with a cancer diagnosis, it's just like one more thing to worry about, and it's nice to feel a little more comfortable about even the small things, and make them easier if possible. All right.